Hello everyone, this is Nasfit Focus. So I'm here to carry out nursing procedure on last office. It's also called post-mortem care on the deceased patient. So in carrying out this procedure, it's a trolley procedure. And on my trolley, I have my tray containing my kidney dish containing dissecting faucet, sponge holding faucet and scissors. And then on my garlic pot, I have my gauze, I have my antiseptic lotion, I have my perfume, my gloves, my cotton wool, and comb, and other necessary equipment. So before doing this procedure, you have to seek consent from the patient's relative. So I've done that already. So in doing that, I have to wash my hands. Okay. After that, I put on my apron. So I have to put on my protective gadgets. So I won't cover my nose because I have to talk. My glove. So this is my basin, trash dish. This is my bowl containing water. In it, I'll put my antiseptic lotion, and my soap, and this is my flannel. So in carrying out this procedure, it's you have to provide privacy. Even with the fact that the patient is not alive, you still have to provide privacy and respect the patient. So this is my screen. So I expose the patient. So you should not expose up part of the body. So before you clean the patient, you have to make sure that all the cannulas and other things you did for the patient should be removed. So I have to remove the cannula on the patient, and then the patient was on catheter, so it's being removed and discarded. So after that, I'll have to clean the patient. So in cleaning the patient, when you start cleaning and then you feel the water is dirty, you can change it and then put another water. So you start with the head to clean, and then the orifice, you have to concentrate more on the orifice because of secretions. So any secretion from the mouth, you clean. After that, you don't have to talk too much. You have to respect the deceased. The needle is a bit faulty. So even genitals, the orifice, you have to clean. Make sure you clean very well. And then going through the legs. So you feel cleaning. Sorry, I have to remove this because it's dirty. So I put it on you. So after that, so using your sponge holding faucet, you pick the cotton wool and then put on the orifice. So I'm putting first on the nostrils. Pick with your dissecting forceps. Make sure it's well covered, because this is one of the area where there's more secretions. So make sure it's well padded. Put in the eyes. You also pad the eyes. So in doing this, you can also use your plaster to also spigot it. Sorry guys, my model is not cooperating. So same thing to the other eyes. Using gauze to pad the genitals. So you had I'll be padding the anus and the VJ. So after padding the orifice, I'll use my shroud to cover the patient. So after that, I also use counterpart to cover the patient. Using my tourniquet, tying the patient's hands together and also the foot. Sorry guys, my model just tie, and then after doing that, you attach your the ID of the patient. This contains the details of the patient, the time of death, the name of the patient, the date of dispatcher, and then the gender of the patient, the ward, the age of the patient. So you attach it to this and tie. Attach it like this and tie. And then you do same thing to the foot of the patient. So I'm done. So I'm covering the patient now, getting him ready to the mortgage, or rather to the mortuary. Patient is set to be wheeled or taken to the mortuary. At this point in time, you can actually give the relatives the time to come see before taken to the mortuary. So that you can actually spray perfume on the patient at least. You remove your gloves, very important. You wash your hand again, then you dry. So the document, very important. Remove my. All this should be properly discarded or kept in the right place for disinfectant to disinfect and to wash, and your equipment well kept. So thank you so much guys, and please like, comment and share.